Hey everyone, James Marin here, your founding clinician of Meelio, and we're getting to the cool stuff here. So I'm going to show you how I generate a care plan, a clinical note, meal plan it's insane the shortest amount of time. This used to take us so long, especially for our newer providers, getting the flow, getting into more of our integrative and functional practice and how detailed we are. This could take hours, especially for a newer provider. But with Meelio, it is so fast. Let me show you. So here we are. Some things are blurred out because this is an actual patient note. It's a little bit of an older note that I didn't complete because I wanted to show you what's happening here. So in this scenario, I just finished a visit with the patient and I've stopped the visit. So I'm just click the stop button on the little widget, or you can go into Meelio and click stop. And now it'll generate a full transcription. So what I like to do and what you can do is download this. I like to download this transcription here as a PDF and I save it. We attach it to each of our encounter notes for our patients. That's part of our flow. You can totally do that. That way our patients can look back and see everything you talked about in the entire visit, which is really cool. It also pre-generates a summary for you. Now, this isn't quite the clinical note or the care note per se, but it's a nice little summary so you can review, you can edit down below. And so you can, if there's something you want to delete, you want to add, you want to create more detail, you can do that there. I'm going to cancel that. And here is also where it's important, and as a note, and we'll get into this a little bit later, it's also linked down below in the resource documents that you can access through Meelio, are your templates. This is where your templates are very important because as you customize initial visit templates and follow-up visit templates, or if you're more diabetes focused or GI focused, or endocrine focused. So Meelio will generate a template that you enjoy and will actually use. It's much easier to edit and you can immediately use it and put it back into your encounter notes. So that's important of going into your library and customizing or even using one of our templates that are already available that matches exactly what you like. But here we go. So what I'm going to do is go to generate clinical note. So you can do that, but here with the Meelio AI agent, it's HIPAA secure, it's encrypted. This is like your internal AI agent, and you can really say whatever you want, but I'm gonna generate clinical note. So we're doing that. Meelio is thinking for a little bit, and it's going to start to get the template and generate the clinical note. So there's our clinical note here. This was a shorter visit, but what you can see here in the foundational assessment to the right is a really beautiful clinical note. So it really just goes through a lot of what I've outlined here: chief complaint, health timeline, triggers, mediators, functional review, dietary and lifestyle history, relevant medical history. You can go through this and see prior lab work, ICD-10 codes, post-visit action list. So I can just download this or I can copy it and move it. We can also send it to Serbo. So we use Serbo. I wanted to move myself out of the way a little bit there and show you on the lower right here, you can send to Serbo. And so this will push the note into Serbo if you like it just the way it is. And this clinical note works for you. And so it gets very, very detailed and it'll have everything you need here for your patient summary and your clinical note. Now, if you want to go to the care plan, I'm going to click generate care plan as well. Click that. Excellent. So Meelio has generated our care plan. If we look over here, here's our care plan with the phases that we've outlined. So we've kind of templated this to go into the phases that we have for this patient and what we're going to do, what that includes, the foods that we use, the supplements we use. So this is already pre-formatted. And so Meelio is just taking what happened in the visit, what I've uploaded with the patient, and what we've pre-formatted in our templates to make exactly what we want. So this is really, really cool. It even gets better. So again, that was a clinical note, care plan. Now we're going to go to meal plan. So we're going to hit generate meal plan, and I'm going to press that. So what's really cool here is Melio's just confirming everything with me so I can look at phase one and phase two assessments. So I'm looking at target calories, his weight status. So this particular patient is a little bit underweight. He's having some really severe GI issues and not trying to lose weight, but it's happening a little bit. So we're really trying to help him there. So I'm just reviewing all of this. I can see the macros. I can see if the targets look appropriate and I can adjust. I can tell Meelio to add more protein or add more fat or no, remove certain allergens, but it really does a great job of knowing my patient, looking at his documents, looking at visits, past visits, and the current visit, and really helping me assess what he needs. So this is very accurate. So I'm going to say proceed. And this, like you, used to take us hours. So we'd actually have our office admin assistants make meal plans using a third-party software to look at all the allergens, look at our recipes, and make the meal plan. Here you're seeing Meelio generate it within, I think that was like less than a minute. So Meelio has given me a quick highlight: low irritant textures, microbiome support, stool firming, fatigue management. We're looking at our 7-day meal plan of breakfast, lunch, dinner, and snacks. And so I get to review this, look this over. Right now it's looking good. So I want to proceed. So I'm just going to hit proceed. But I can and you can make tweaks. I've also had Meelio and I've asked Meelio if you can find me snacks. I have patients sometimes in London. I have patients sometimes in Australia, and I'm not familiar. I've been to London. I haven't been to Australia yet. I hope to go very soon, but I'm not familiar with the certain grocery stores and snacks around there. So Meelio can even suggest where to find some snacks, store-bought snacks in your patient's area, which is really, really cool. Would you like me to proceed with creating this meal plan based on the recovery strategy we've outlined? Boom. Or is there another task you'd like me to handle? And I will say, so if we look over here, we see that the meal plan is generated. It's waiting for our input here. I'm going to say proceed. And you can just say yes. You can say whatever word you like, but I like saying proceed to Meelio. Okay, here we go. Okay. Do these targets look appropriate? I'm going to say yes. Okay, so as we reviewed what Meelio is summarizing for us, we are confirming and we are making any changes we need to. And as we go right here to the right and we look at the top from our transcription, our summary, our assessment, our clinical assessment, our care plan, and now our meal plan, we get to see the meal plan starting to take shape as Meelio is creating it. So we get to see all the days that we've created. We're getting to see the recipes. We're going to start to see pictures and details of each recipe. So these are actual recipes that your patients can follow and use, and you can continue to customize them by adding more spices or removing more spices. I've uploaded some of our handout instructions, whether they're low FODMAP or low histamine, low sulfur. You can really customize these recipes to whatever your patients need and make sure they're getting exactly what they need. So our meal plan is done. We have our pictures, we have each day. We can go into, let's say, this creamy oatmeal and look at the ingredients, instructions. We have our shopping list for each item. We can look through each day and we can summary. And what we can also do is download as a PDF. There we go. We could download as a PDF and save. What we like to do is save a PDF option for our patients and then attach it. But an easier way, if you're using Serbo, is you can send to Serbo as well into the patient's note. And so here we have everything we need for our patient. Everything nice and neat, the way we like it organized in such an amazing level of detail, as well as a meal plan that used to take our admin assistant a lot of time. Over time, she got better with it and it went from 2 hours to maybe 45 minutes, but still 45 minutes. That's now taking maybe a couple of minutes to generate. And we have a nice little meal plan here with everything we need for our patient. So this has been really cool. I've been also chatting with Meelio this entire time, giving input, seeing what needs to be tweaked and modified, and then we can generate exactly what we need. So this was mind-blowing for us to create and just really harnessing the power of AI for integrative and functional practice. We hope your mind is blown as well and it is serving you, serving the needs of your patient, helping you cut the time in the office so you can be with your family, your friends, and do what you love to do and still love on your patients. Until next time.